ICRH Kenya is a locally registered non-governmental organization. Started in the year 2000 in response to the International Conference for Population and Development, 1994. ICRH was started by Marlene Temmerman and colleagues from the Ghent University in Belgium. In Kenya, we work in both research and intervention projects in the field of sexual and reproductive health. Our work falls under four main thematic areas of sexual reproductive health, and that is sexual and gender-based violence, adolescent and young people sexual reproductive health and policy rights, maternal child health and family planning, and HIV and sexually transmitted infections, especially for key and vulnerable populations, which includes female sex workers, men who have sex with men, and transgender persons. Our expertise as an organization is in program management, in research, monitoring and evaluation, and advocacy for sexual and reproductive health.
The Amplify Change project is basically a project that seeks to promote awareness among key stakeholders, and it also strengthens institutional collaborations for GBV response in Mombasa, Kenya. So our activities have been aligned to four main indicators. The first one being to establish and to strengthen already existing partnerships with SRH allies, and we've been able to engage media persons, religious leaders, police officers, and also helped in setting up the technical working group for sexual and gender-based violence in Mombasa County. Our second main indicator is to see the increased range of services and products towards the alignment of SGBV, where we continue to offer services through the Gender-Based Violence Recovery Center. And we've also been able to develop various IEC materials on SGBV awareness and SRH advocacy that have been shared on our different social media platforms. Our third indicator looks at strengthening the capacities of CSOs so as to advocate for SRH through capacity building. So we've been able to do capacity building for our staff at the GBVRC, and we've also been involved in policy process through the technical working group for SGBV, and we are currently working towards the development of the first gender policy in Mombasa County. Lastly, we seek to increase reporting and also increase legal support of our sexual violence survivors through paralegals who have been engaged by the International Center for Reproductive Health, and they do follow-up of sexual violence cases from the GBVRC centers to the police stations, and lastly as the court.
At ICRH, we believe in equality, we believe in diversity, we believe in commitment to the communities we serve, and we believe in social accountability. When serving our communities, we believe that community needs and community perception and desires supersede everything else, and we live by the mantra of nothing for us without us, which means our communities design the programs, monitor and evaluate the programs, and establish the necessity and the importance and the effectiveness of these programs to them.